morning. Welcome. We have with us today Edward Amond. Edward Amond, Psy.D, is a clinical psychologist at the Amond Group in Lexington, Kentucky, and he's licensed to practice in both Kentucky and Ohio. Dr. Amond focuses on the social, emotional, and educational needs of gifted youth, adults, and their families. He has co-authored 2 award-winning books, A Parent's Guide to Gifted Children and Misdiagnosis and Dual Diagnosis of Gifted Children and Adults in its 2nd edition. And he's authored many articles, book chapters, and columns about gifted children. He presents locally and nationally on topics related to the needs of gifted children, and he is actively involved with NAGC's Parent Editorial Content and Advisory Board, SAM's Professional Advisory Committee, the G-Word Films Advisory Board, and the Kentucky Association for Gifted Education. And we welcome him today to be a part of the New Mexico Association for the Gifted's annual conference. Welcome, Ed, and thank you so much. As you know, I'm one of your biggest fans, and I even have a signed copy of your book, Misdiagnosis and Dual Diagnosis. And we met through a common friend and mentor, Jim Webb. And so the first question I have for you today is, how did you get to know Jim, and how did you start specializing in the field of the psychology of the gifted?
Yeah, well, hello, and thank you for that introduction. I'm happy to have the opportunity to talk to everybody. In a word, how I got into the field of gifted education, the best word is luck, really and truly. I was an undergrad at a small school in Pennsylvania, thinking about graduate school. And for those of you who have majored in psychology in college, you realize there's not a whole lot you can do. There's a few opportunities, but there's not a whole lot other than graduate school that you can do with a 4-year degree in psychology. So I thought, well, I'll continue on to graduate school, and my professors at college were supportive of that. So we were looking into options, and they encouraged me to try to apply to some Psy.D programs as well as the PhD programs. And so I was and found Wright State University, which is about 5-6 hours from where I was at the time, and thought, okay, well, I'll apply here as well, and apply to a variety of other schools. And I ended up at Wright State primarily because they accepted me. That's why I ended up there. And, I had other options, but that was the best of the options. And so I went ahead to Wright State. I did not go there because I knew that Jim Webb was a professor there. Didn't even know who Jim Webb was. But it turns out that he was there. And one of our first classes at Wright State was cognitive assessment. And Jim was the professor for that class. And so I got to know Jim through that class and learned a lot about the IQ tests and cognitive measures and a variety of other types of tests. By the end of that class, Jim said to me, he said, hey, Ed, I'm thinking, you need a practicum next year. Would you like to work with me? And as you know, as a graduate student, the correct answer to that question is, yes, sir, I'd love to. Really know a ton about what he did. Of course, he talked about it in the class. And I happened to have a roommate who had worked with him a couple years before. So I did a little bit more digging and research and found out that, a lot more about what he did, and it sounded kind of interesting. The first assignment he gave me as his practicum student was to read his book, Guiding the Gifted Child, which at that time was about 10 years old. And he said, read this and see what you think. And as I read that, it just kind of made sense. It illuminated a lot of things for me. And I said, this is an interesting field. So I worked with Jim for that year, finished up my training, working with adults and working in other settings. And then eventually, after I finished my doctorate, I tried to get back into the gifted field. And it took me a little while to work my way back in, but I was able to, a couple years after graduate school, get a job working with Sylvia Rim in Ohio. And that was kind of what brought me back into it. But it was at the time I worked with Jim in the early 90s that I said, this is a field that I do want to work with, I do want to get involved in. So really it's just a series of fortunate events that got me here. And and even the job with Sylvia was another series of fortunate events. Jim Webb, Jim Delisle, Sylvia Rim, all of whom I had known at the time, knew of each other and knew of the job, and they got together, and that's how I ended up working with Sylvia in the mid 90s before I moved here to Kentucky in the late 90s.
Well, fortunate for us as well that you got into this field and pursued it. So at the time you wrote the first edition of Misdiagnosis and Dual Diagnosis, I think gifted children and adolescents were frequently being misdiagnosed by physicians, by psychologists, by psychiatrists. Do you think that's happening less frequently now, or do you think it's still a problem?
So that's a really good question. And we have a little bit of research, still not a ton of research is being done on this particular topic, but there is some research beginning to show that that this continues to happen. The frequency is still pretty unknown, but I do see it happening. And I would say that when we talk about misdiagnosis, we do need to lump that in with the issue of misdiagnosis. So when we talk about misdiagnosis, are we just talking about diagnosing something that's not there, or are we also talking about missing something that is there? And I think I like to put those two together under the topic of misdiagnosis and say, yeah, we are doing a better job of identifying gifted kids and a better job of recognizing that they have that they present a little bit differently, and so we're doing a better job of diagnosing accurately. And I always say that, you know, when we talk about misdiagnosis, what we're really talking about is accurate assessment. We're really talking about accurately assessing this child for their needs. What are their needs, and how do we meet those needs? But as I always say, you know, accurate assessment of gifted children it isn't a great title. Misdiagnosis sounds a whole lot better. And so that's why I ended up being misdiagnosis. But accurate assessment is what we're really talking about, finding out what these kids really need and getting there. So I think we're doing a better job of that. But I will say, and this is one of the criticisms of our first edition that we tried to correct in the second edition, is that there were some people reading that book who thought that we were excusing behavior problems and saying, well, you know, that doesn't matter because this child is gifted. And that's clearly not what we were doing. We were trying to present alternative explanations for some of the behaviors rather than say, no, don't worry about that behavior because they're gifted. But I think some people interpret it that way. And so what ended up, I think, happening in some situations is then there became some misdiagnoses in that people were saying, well, no, that can't be that. This is really just gifted. And so we missed some of those. So I think hopefully now here in 2020, we are coming to a balance of accurate assessment and not necessarily missing things and not necessarily misdiagnosing things as much as we were 15 years ago when we were at the first edition.
Thank you. I'm going to ask you a little more about assessment later on, but what are the most frequently found misdiagnoses or missed diagnoses, and why do you think that happens?
Well, these days, I will say the most one of the most common diagnoses we're seeing is anxiety disorder. Not a lot of people are missing that these days. Midst of a pandemic, and there's tons of anxiety and tons of uncertainty in the world, and so we're seeing that. But what we typically do under typical times, we see ADHD being one of those things, because it really can be a difficult disorder to diagnose. When you're looking at ADHD, the technical diagnostic criteria is just these behaviors. We check these 6 boxes in this particular category. And if that's all we're looking for is those behaviors, then yes, they may meet that criteria. But does that explain why those behaviors are occurring? And again, the simple example is inattention. You've got a kid who's not particularly paying attention in school. Why are they not paying attention in school? Well, if they check these 6 boxes, many assume that must be ADHD. But as we know in the gifted field, if they're not engaged in the curriculum, they may be. I always tell the story about the second grader who was very inattentive in school. was going to school, was really struggling. The parents took him to the pediatrician, diagnosed him with ADHD, put him on medication, didn't really help much. Said, we don't really know what to do. Came in for an evaluation, found out that his IQ was 145 and he was reading at 11th grade level. He was inattentive in 2nd grade. So we worked on the curriculum, we addressed it that way, and he did not need the medication because it wasn't helping him anyway. So that's an extreme situation, but the inattention and figuring out where that inattention comes from. So ADHD, either the inattentive type or the hyperactive impulsive type. And I always tell people that they decided to make our life more difficult. What we used to call ADD, they now officially, the diagnostic category is attention deficit hyperactivity disorder, predominantly inattentive presentation. So they just wanted to make it a little bit more formal. So we have ADHD inattentive type, we have ADHD hyperactive impulsive type, ADHD combined type. So that's probably the most frequent question we get. Does my kid have ADHD? Is this accurate? And so what we do is try to, first, of course, assess for the behaviors. Are the behaviors there? Because if the behaviors aren't there, then there's no diagnosis. But first, if the behaviors are there, then we try to look and say, what is the explanation for these behaviors? How do we do that? And other things we're seeing, again, not as much because the knowledge base is really coming online now, is autism spectrum disorder. We see, again, we don't see anxiety missed very much these days. Same with depression. That's something that also is there. So a little bit with bipolar disorder, but not so much anymore. It's again, we're getting, excuse me, a lot more information about it coming out. So yeah.
Well, thank you.
Here we are.
Yeah. The past DSM had a category for Asperger's, which is no longer there. Has that had any impact on gifted diagnosis or not diagnosis? Was that an often misdiagnosed or misdiagnosis?
Yeah, we're seeing, because of the little bit more stringent criteria with autism spectrum disorder versus the Asperger's, we're seeing a lot of individuals who were identified with Asperger's disorder really don't have a home in terms of diagnoses at this point. They're still impaired in some ways, but they're having trouble getting the services because they don't have that diagnosis. Yeah, it is something that's of concern. And it is also something that has led me to do a lot more consultation with other professionals in terms of diagnosing autism spectrum disorder when I am contacted about a gifted individual that we're wondering if they may or may not be on the spectrum. I'm more likely over the last 5 to 7 years to bring in additional colleagues who have a little bit more expertise on the spectrum than I do to help out with those types of evaluations, because I think it can be really difficult, especially as these bright kids get older. They've been diagnosed with autism spectrum disorder or Asperger's disorder at younger ages, and now they've had 10 years of intervention. They've identified at 5 or 6. They're 15, 16 now. They have had 10 years of intervention. They've used their cognitive abilities to help compensate. In an hour or 2 hour meeting at an office, they may not look as impaired as they really are in other situations, like a 7-hour school day or something of that nature. So it can be very, very tricky. I always use the example for me. One area that I don't work a lot with is substance abuse. I don't feel like it's an area of competence for me. I don't have the knowledge and background. So if somebody comes into my office and says, I have something going on, and their primary issue is substance abuse, unless they say to me, hey, Dr. Ed, my primary problem is substance abuse, I will, I'll look for it, of course, as I do with all, but I may or may not connect the dots in the same way because I don't have that same background and knowledge information about substance abuse that other people do. And so I may completely misdiagnose that situation and start down a path of intervention that is not going to be effective because the primary issue is something that I don't quite get. And that's, when we talk about misdiagnosis, that's typically how some of those things present. It is a gifted kid coming in and not necessarily recognizing the the characteristics, the way they present, and so potentially misconstruing in the way that I would with something related to substance abuse.
I see.
Yeah.
So it seems like that there's been kind of a pendulum swing in terms of, so when you wrote the first book, the first edition came out, and there was sort of a shift, at least among gifted folk, that some of these behaviors are being misdiagnosed, right? We had kind of a pendulum shift. Okay, so it's not ADD, it's not ADHD, it's it's not ASD, it's not whatever, it's just the giftedness, right? And now it's kind of shifting back so that it's more balanced and you're having more accurate assessment, and there are dual diagnoses. So giftedness does also occur with other diagnoses. What is the diagnosis you see most often that's a dual diagnosis for gifted?
Right now, it's anxiety. Before now, I would say I see quite a bit of ADHD overlap. There are a few other things, but those are probably the most common. We're seeing a lot of the autism spectrum diagnoses as well. I don't see quite personally as much of that in my practice, but we are seeing a lot of that. I think we're talking about neurodiversity in a different way than we ever have before, which is fantastic. We're looking at twice exceptional kids and recognizing that they really do exist. They're not this, unicorn that's out there, one, that we never see. They're out there, and they're out there with frequency. And we are doing a better job of identifying those things now than, again, we ever have. So, again, the most common right now is anxiety, because there's just, again, so much uncertainty in the world that we live in right this moment. And for anybody who happens to watch this 5 years from now down the archive, finds it on YouTube or wherever, of course, we're in the middle of the COVID-19 pandemic right now, and so we're seeing all kinds of anxiety come through the door here with our gifted kids, because there's so much uncertainty in the world right now.
So this right now, I'm seeing the same thing. We have a lot of kids with anxiety. Are these kids that had anxiety prior to the pandemic, or have developed an anxiety disorder because of the pandemic?
That's a good question. And I would say the ones that I'm seeing, they had some anxious tendencies. They had some perfectionist tendencies, perhaps, but now it has manifested as an anxiety disorder at this point because of again, the additional uncertainty. So, but many of them are, it's interesting. Let me back up and say it's interesting about anxiety, because there's a subset, it's a smaller subset, but a subset of bright kids who were anxious before the pandemic, who are less anxious now. Those kids who were worried about going to school and getting sick, or not leaving the house anymore. Those kids who were worried about, who had anxiety related to social pressure, or anxiety related to school pressure, or just making it through the day in school. So that small subset of kids are actually less anxious now. I had a few of them that were scheduled, and when the pandemic hit and we shifted all over to teletherapy, I was calling families and saying, okay, we're going over to teletherapy, and some parents were saying, you know what, he's just not anxious anymore, he's doing great, so I'm pretty sure we don't need anything right this moment. So I think that we have to always recognize the situational influences on our gifted kids and how much they can affect anxiety, depression, and those kinds of things, because it's very, very real when we see things like that. Oh, well, he doesn't have to be around kids right now, so he's not as anxious. Now, of course, does that mean there's a potential issue that we need to deal with? Because eventually he's going to be back with kids. Yes, we have to find ways to manage that anxiety in those situations. But in some situations, it's decreased right now. So again, I'm not, this is not I go back to that. It's not an excuse. It's an explanation. It explains why we're seeing less anxiety right now. It doesn't make, in some cases, it doesn't make it okay because we're just covering it up for a little while. We still have to address it in some way.
Great.
That, anxiety wise, we are seeing both of those aspects increase in some kids and decrease in others.
There's a lot of anxiety among gifted kids. It seems that they're more prone to anxiety. What do you think the characteristics are of the gifted makeup that make them more prone to anxiety?
Well, we know that bright kids are aware of lots of things. In psychology, we always talk about those kids whose parents are going through a divorce. They get really big ears. They hear everything that parents don't want them to hear when their parents are struggling and fighting and heading toward separation or divorce. I think that's true of gifted kids all the time. Their ears are really big. They hear everything, so they are aware of things that perhaps other people aren't aware of. When we look at the possible outcomes of a situation, we may see 3 or 4. We may see 8 or 10. A bright kid may see 752. And I think you can see it in day-to-day activities with gifted kids. When you ask a gifted kid a specific question like, well, oh, you just went on vacation. What was the favorite thing you did? That gifted kid. 9 times out of 10, you get the gifted kid who goes, favorite thing. And they look like a deer in the headlights. Why? Because they just went to Disney World. Well, they can't now, but of course, before the world changed, they went somewhere that was really, really great. And you've just asked them to pick the one thing that was the best. And they may not be able to identify that one best thing. There may have been 17 great things, and they just are going through their mind about, whoa, this one's pretty good, but which one's better? And so they get to that point of just being paralyzed by that. It's because they can see so many possible answers to that question. It's kind of like when my friend who was doing, I have a friend who's doing, I live in Kentucky, remember, a friend who's doing a study on bourbon. And he's bringing over people to do bourbon tasting. Well, he was, again, before the pandemic, bringing people over to do bourbon tastings. And he sets, 4 or 5 different bourbons in front of you to sample. And it's kind of like going, oh man, I like bourbon. Oh, these are pretty good. I just can't figure out which one's better. And trying to rank order them was really, really difficult, And so that's where the gifted kid is with, oh my gosh, 17 great things on vacation. And so they're stuck. And so, of course, I recommend asking a more open-ended question. If you ask a question like, hey, what were some of the things you did that were fun? That's a way easier question. That's a way easier question for a gifted kid because they don't have to come up with that one correct answer. And they don't want to be held to it in case they give you an answer that was the best thing. And then later on they think, oh, I forgot. How can I forget about this? I gave them the wrong answer. So that, in someone's critical thinking, that thinking ability, that ability to see possibilities, I think contributes to anxiety some of the times. Of course, you've got the sensitivity. We see bright kids who tend to be very, very sensitive. Again, sensitivity is not solely the domain of gifted kids. There are a lot of people who are not identified as gifted who are also sensitive, but we see our gifted kids being more sensitive and more affected by negativity. So those 2 aspects, I would say, are play a big role in doing this. So, yeah.
Thank you for that. So can you talk a little more about when you were talking in the beginning about accurate assessment, the assessment process itself? Can you talk a little bit about how you do that and how you kind of do that differential diagnosis?
Yeah, it can be a pretty complicated process. So the things that we do here in the office is, well, the first thing we do is we try to find out what the parents want out of the assessment. We don't necessarily have a standard assessment where people come in and we say, this is what we do. We try to listen to the parents' concerns and try to identify what do they really want to know? What are the questions that they want to have answered by the time we're done here. And then we create the battery. And then, of course, there's some overlap. There's some things we do quite frequently, but we start where they are. And that's a phrase that you probably heard Jim Webb say a million times. We start where they are. This is what they want to know. And this is how, so we outline, this is how we're going to do this piece, and this piece to assess those. So let's say they want to find out, does my kid have ADHD? We're, of course, going to collect the behavioral data like everybody else does. We're going to have them fill out the checklists and see, do they check these boxes? But we're also going to do tasks of attention and concentration, which are not necessarily part of the diagnostic criteria, but we like to see if their working memory, their short-term memory, their immediate memory is affected. We like to see if they can sustain attention. So we use a task of sustained attention. It's about a 15-minute task that's not really interesting, to see how they are able to handle that. So if that's the only question that they have, do they have ADHD? In some cases, that may be all we do. However, if we're looking at a bright kid who's not been identified and the parents think that they're bright, we may also do a full measure of cognitive or intellectual ability to see, okay, where are the strengths and weaknesses? What is it that the school is seeing that, what is the parents that are seeing that the school isn't seeing, and why is that the case? Why is the school not seeing this kid as a gifted kid when we think he or she may be? So, in some cases, we may look at the processing speed, and they're really, really bright, but they can't demonstrate it consistently. Anytime they're put under time conditions, their scores go way down. We may see that. Oftentimes with ADHD, there's a lot of overlap with learning disabilities. So we may throw in a measure of academic ability to rule out any learning disabilities that are there. See a lot of our bright kids who are smart enough to cover up attention problems and learning problems for many, many years. I tell people all the time, you can go a long way through school without ever thinking. You can memorize your way a long way through school. And it's a pretty eye-opening experience when you're sitting in supervision with Jim Webb and he goes, "So Ed, tell me about this client." And then you give him the spiel and you recite all the information that they just gave you. And he says to you, "So what do you think's going on?" I just told you what's going on. Let me read. You want me to read it again? Did you miss that? Here, this is what's going on. But no, really, what's going on? What's your conceptualization? It's like I don't know. Like where you tell me and I remember it and come back tomorrow and tell you, because this is what usually happens. This is what happened throughout 16 years of my school. And Colin Seal, I think is he on the program as well here?
Yes, he is.
I thought so. He's, of course, really focused on the critical thinking aspects, and that's huge for our bright kids because, we see a lot of kids who come in, and when we assess them, they do incredibly well on the tasks that are memory-based because those are the skills that they have developed over the years. But those critical thinking skills, which we know they have because they use them some of the time and primarily against parents, they're critical when they argue against you is really, really good. But they aren't able to show them because they don't know that this is the time or the place. We've got a lot of kids who don't necessarily use those critical thinking skills in school because they, again, never had to. You get these kids who, graduate from high school with a 3.9 something or other GPA. Well, now a 4.9 something, or I don't even know what the scales are these days. They vary. But you get the really high GPA, they go off to college and they get there, and all of a sudden those critical thinking skills that they haven't really used for school are necessary, and they don't use them. So I'm a little bit far afield from your question about assessment, but those are the kinds of things that we will look at, as part of the assessment as well. Looking at those critical thinking skills, do they have them? Is that perhaps why we're not seeing what the school's not seeing, what the parents are seeing, and how do we translate that? So back to the assessment. So it tends to be pretty long. When I tell families, if we're looking at a comprehensive evaluation, you may be looking at 7 to 12 hours worth of time to do all the testing that we need to do, to gather all the information via interview, to review all the previous evaluations, to get everything scored, to go over the results, and to write up the summary for you. You may be looking at 7 to 12 hours worth of time. in terms of getting all of that done if we're wanting to. But we're looking at accurately identifying, is there a twice exceptionality here? Is there a gifted kid? Is there a disorder? What are we going on? And so we try to rule out as many things as we can. And theoretically, that's what you're supposed to do with ADHD. ADHD, you're supposed to kind of try to rule out other explanations for those types of behaviors. Unfortunately, that's not always done. But we want to make sure that the inattention is not related to giftedness. We want to make sure it's not related to depression or anxiety or other types of challenges that can create that. These days, trauma is significant, and there's so much of an increase. Right now, we're starting to see an increase in diagnoses of post-traumatic stress disorder, and that is that's something that we're going to need to keep an eye out on our field of gifted kids, because there's a lot of trauma going on. Just about all of my telehealth sessions start with, "Hey, how's everybody doing? Is everybody good?" Because there's a lot of loss going on in the world right now, and it's not just losing family and friends, but losing activities and a lot of grieving going on, and that's going to complicate these assessment processes as well. And it's a challenge. Now, of course, assessment is complicated by the fact that some of it's done via telehealth. We are seeing still some clients in office here. You can't see behind me, may be able to see behind me. There's a plastic shield, that we have to do assessment behind, and we're taking great care to make sure that that everybody's safe in doing that. So we're adding so many layers right now to this. The pandemic's adding so many layers to our assessment process. Again, with the grief and post-traumatic stress, and just kids in some ways are still pretty out of sorts. I talked about this the other day. I was talking about the spring semester, and folks are saying how much did kids learn, and from a psychological perspective, I didn't really care, because I wanted to keep their head above water, but I don't think a whole lot, because everybody was thrown into this and everybody's head was spinning. Parents, teachers, students, administrators, everybody's head was spinning, and we were just happy to make it through the year. Now we're in a new situation, a new year, where folks are taking a different approach, and we do have to balance all these things so our kids do learn. They have to learn things now, but and so accurate assessment of this child's learning needs is going to help. And making sure we put them in a position to use those skills, use those critical thinking skills, have to work to be successful. Those are the things that that are really, really important. So, all right, that was a long way to go in terms of the.
No, I think that was wonderful.
Kind of went off on a few other things, but.
And I noticed that we almost have to talk pre-pandemic and in pandemic when looking at some of these things, because they have changed so much. So in my next question, I would say, let's go back to pre-pandemic, and look at when you have a dual diagnosis, and some diagnoses, can benefit from medication. ADHD can benefit from medication. Anxiety can benefit from medication. Depression can benefit from medication, if those are true dual diagnoses. So what are you, pre-pandemic, when things were a little more clear cut, when do you think medication was warranted? What are your kind of thoughts about medicating children and adolescents outside the pandemic?
I think when medication is used appropriately, it can be a very, very effective tool. Being a psychologist, not a psychiatrist, I lean toward behavioral and therapeutic interventions first. That's what I would prefer to try. Many times, however, we've got families coming into our office who've been trying behavioral stuff for 6, 7, 8, 9, 10 months. And do I have any new ideas? Maybe not. So the two things that get me to medication sooner rather than later are, one, hair on fire. Like, this is a quality of life issue. Things are bad and everybody knows it. The kid's coming in and the kid's out of sorts and the parents are at their wits' end and there's arguing. The parents feel like, if I'm not walking on eggshells, I'm yelling at the kid. And so everybody is just heightened. And in those situations, I think we need to do something to kind of put out the fire. In that situation, we need to figure out what may be beneficial in this situation. Of course, we need an accurate assessment to find out what exactly is going on, to figure out which medication might be the most beneficial. But or at least what category of medication might be. So that's the first thing. When things are just so out of control, we need to do something. Most of the cases that come in my office are not there. They're not at their wit's end. The second thing that gets me to medication sooner rather than later is let me back up. One of the things that I do come into my office is I like to do the scaling question. So I'll ask parents, 1 to 10 scale, how bad are things right now? 1 is terrible, 10 is where you want things to be, right? And we'll kind of get a sense of where they are. 9 times out of 10, the parents are way lower than the kid. The kid's like, yeah, everything's great. I got an 8. I'm doing pretty good. I'm everything. And the parents are like 2. It's a 2. So, but in those situations, obviously we're going to work with the family. We're going to try to develop the situations. But the second thing that gets me medication is when the kid is as concerned as the parents, or more concerned. When the parents are coming and saying, it's probably about a 5, and the kid's saying, no, it's a 2. When it's starting to affect the kid in that way, when that individual is struggling so much, their self-esteem is, so for ADHD, in a situation where it's ADHD, the child is coming home going, smart, but I don't feel smart. I can't do these things. Why can't I do these things? In those situations, when the child starts to doubt their abilities, that is the second thing. When it affects their self-esteem, when they're as distressed or more distressed than the parents, that's the second thing that gives me the medication sooner rather than later, because I don't want that child to develop a mindset of, I stink at this. I'm always going to stink at this. We do want them to have that mindset of, I can get better at this, I can manage this. And that's the mindset we try to take with ADHD. Sure, your impulse control stinks. You can get better at it. And I think I like to believe everybody can get better at it. The question is how much, and when we look at ADHD, there are some people that can develop better impulse control, but and I guess as I'm talking here, that would be the third thing that gets me to medication. As we're doing behavioral interventions, we're seeing an upward trend. Everything's getting better, but then we plateau and we're stuck. And we're still not at the level where everybody would like to be, and so that might be a third reason you'll say, okay, you know what, we've been doing this for a while, we've made some progress, but now we're leveled out and we're not getting better anymore. And is this a point we need to look at medication to kind of give you that boost to get over that hump to keep growing? And I'll just jump in about medication, because this is almost always parents and teachers' second question about medication is, so how long? I have to be on medication? And I don't have a great answer. Most people don't have a great answer. It is, we like to see progress, we like to see improvement, but I know that with certain kinds of interventions, they are a forever intervention. I wear glasses, and I'm going to wear glasses for the rest of my life. If we're not going to get to a point where I say, oh, geez, I can see, let me get rid of this. We're not going to do that. We're not going to be able to take that intervention away. And some medications may be necessary. And there are there are a lot of people who believe that ADHD is a lot like juvenile onset diabetes. If you need insulin at 4, you're going to need it at 14, 24, 34, 84. You're going to need it for the rest of your life. And I believe there are some people that fall into that category. There are people who need medication and may always need medication. I believe there's another category of people with ADHD who are more like the adult onset diabetes people, who need to change their diet, change their exercise, manage their weight, manage things a little differently. And they can do all those things and manage their type 2 diabetes. Some need to do all those things and take medication, right? And ADHD is, I see it similar to that. Of course, it's not diet and exercise. Those are not, those are not proven to be significantly beneficial. They do help in terms of, a healthy lifestyle and things like that. But there's no diet or exercise regimen that proves to cure ADHD. So, but with people with ADHD, they need to structure their life differently. They need to develop organizational strategies. They need to develop ways to cope with the challenges that they have and manage their impulse control and manage their focus. Some people can do that. Other people need to do all those things and take medication. And so it's a situation that is fluid for most folks. I've heard some folks say, if you have improved on medication, like, so for example, you're taking an antidepressant, then you took it for a year, and you finally got stabilized for, at that point, and you're feeling pretty good. Maybe you should take it for another year before you start weaning off, as long as it took you to get to that state place. But, I'm not hearing that from a lot of folks. I'm hearing that from the minority of folks. So there's really no good answer to that question of how long would we need to do this. I think it's a very individual decision for most folks. But it is something that often get asked. So.
Thank you for that. With the increase in anxiety and depression during the pandemic, do we just look at that as situational and not go overboard and prescribe, or do you still have the same thoughts and measurement for when you would recommend medication during the pandemic?
Yeah, I think I'm pretty similar right now. One of the challenges we have is getting in with psychiatrists. There's just not enough psychiatrists for children anywhere, really. And so it can be difficult getting in to manage that. If it's a pretty straightforward situation, we do have many pediatricians and family practice physicians who are comfortable prescribing, say one medication. But once you get into those complicated dual diagnoses issues, they got some anxiety and some ADHD, a lot of them are very uncomfortable doing that, right? So that's not their training. So but getting them in with a child psychiatrist can be a challenge. So I'm getting more and more questions about ADHD now. Virtually everybody doing virtual learning and being on screens several times a day, and so we're looking at that closely, but I don't have great recommendations on that yet. I can say this: I know that when I shifted from in-person therapy to teletherapy, and this is before. So full disclosure, I got sick back in April. I think I've told most folks, and I'm doing these things, I got sick back in April. But before I got sick, just doing teletherapy all day was way more exhausting than doing in-person therapy. And since I've kind of bounced back, I'm here now, and I've gotten into the habit of doing it. It is still more exhausting. In the past, I would schedule clients from 1, 2, 3, 4, 5 o'clock clients. I have a 1, 2, 3, 4, 5, 5 in a row, and that went fine. That would work fine for me. Now I have to have a break. I can't do more than a couple in a row before I need some downtime. It's a challenge because it's more exhausting. So I don't know if that's affecting our kids being online more. Again, we don't have a ton of research. We've got some preliminary research coming out now about that, but we know that it's a challenge for everybody. So there, I don't remember where I was going with that. That's one of the things I've noticed since I've been sick. I kind of start somewhere. I had somewhere to go with that, and I lost it. But there was a point at the end of there somehow. But,
you were talking about ADHD and the need for you're seeing more people come to you for ADHD now on screen all day long.
That's right. Yeah. So we I know that the screen time has personal effects on me, but as we all know, an N of 1 is not our greatest sample size. But I am hearing a lot of parents asking about how much is this affecting my kid? Is this additional screen time affecting their attention and concentration? So yeah, that's where I'm going. Thank you.
We have just a couple minutes left, so I just wanted to kind of leave it open-ended. What else do you think you'd like to share today?
Oh gosh, that's very open-ended. Now I have 17 correct answers here. Come on, no, I'm just kidding. All right, let me think. What else do I want to share with with the audience? I think that one of the things I've been talking a lot about is during this pandemic, there is so much uncertainty and so much ambiguity in the world that we don't really know. And that's hard for us to wrap our brains around. We do the best we can to identify the things that we can do. And I talk quite a bit about focusing on those things that you can control in normal times. I talk about, I use the expression, what's inside your boat. Let's focus on what's inside your boat and what you can control in these situations. And when we look at the pandemic right now, that's especially important. It's focusing on those things that you can control. There are so many things in the world right now that are outside of our control, but what can I do on a day-to-day basis to get control of the things that I can and help me feel a little bit more comfortable and find some kind of routine. It's so hard right now to do those kinds of things, but if we can focus on those things that we can control, that's important. And secondly, don't forget about the trauma and grief that people are going through right now. And again, we often think of grief just as, lost my loved one. But no, there are kids that are grieving so many things right now that we may not even think about. The big ones, of course, graduations, starting college. They're grieving the loss of what they thought they were going to get. And we have to be aware of that as we're helping them, as we're working with them. But it's not just those big things. There's small things, day-to-day things that kids used to do that they can't do right now. And so recognizing that we're all going through this together. So, it is important to check in on mental health, but that's not the only thing that we have to do, of course, but that's important for, I think it's important for teachers to do that. But again, and not in a, I'm not expecting them to move over to therapist role, because I think they all recognize that that's not where they want to be. They didn't become therapists, they became teachers, and when they want to teach. So, but I think it's important to do that. So, those are the things that I think are important and probably good things to share. Don't forget about the grief, and make sure that we are connecting, make sure that we are working, hand in hand with the parents, because everybody's trying to negotiate this new normal right now. And I don't know that, I don't know that we're even there yet, because there's still so much uncertainty. And focusing on those things that you can control, creating as predictable of a routine as you can, and just being genuine about the mistakes that you're going to make along the way, and recognizing that nobody's perfect, and especially now we're all kind of learning as we go in so many ways.
And thank you so much for being here today. We really do appreciate you. Thank you.
You're very, very welcome. Appreciate the opportunity to chat with everybody. If folks have questions, they can feel free to reach me through my website or email. We're also on Twitter and Facebook at the Amen Group, and be more than happy to answer some questions if folks have specific questions about things that I said today or anything like that. Be more than happy to help if I can.
Thank you.